There's so many barriers to care. Too many families that really need the help can't get it. They can't get off work. They have many kids. They have to take public transit. So we have the most vulnerable families and communities not getting the care they need. So the only way we're really going to improve access is to make sure we go out into the community. We build relationships with community leaders, we ask what they want, and then we listen. If there's something that we can do to help, we are more than willing to do that. That's why the Skyway example is a wonderful example of Childhaven partnering with Skyway, but not dictating the course or the direction of growth for that community. The idea of love everywhere and care everywhere is truly radical. It sounds really nice and it feels really good to hear, but when you really kind of dig the layers, pull the layers back, you realize this is a very revolutionary thing that Childhaven is endeavoring. Because what we're talking about is the essence of the agency and social justice. Love everywhere means something very different than what Childhaven used to believe, and that is that the experts are the parents, are the caregivers, are the early educators. Those are the experts, and we need to figure out a couple things. One, how do we increase access to care, and how do we destigmatize the care that we provide? We must have a sense of cultural humility for care everywhere to work, or else we won't have switched the power dynamic that needs to be switched for healing to occur. So what we're doing at Childhaven, we're in a number of primary care clinics, and what we've learned is when we provide early relational health in a primary care clinic, it really destigmatizes the care. Not only does it destigmatize the care, but it allows families that oftentimes would never get that type of support. I think true healing only happens when there's true collaboration. And for true collaboration to occur, there has to be a deep sense of trust. And when you're talking about early relational health and you're tying that into primary care services, it's a beautiful blend. It's a blend that allows families to get what they need when they need it. I've never met a parent that didn't want to be a good parent, and we need to help them with that. Parenting is extremely challenging, and if you're already dealing with multiple stressors in your life, you probably don't think you're a very good parent. But when you meet somebody, possibly somebody from Childhaven, that provides focused attention and listens to you and hears your story and sprinkles in some skills and believes in you, sure enough, every parent has amazing resilience and strength and wisdom. We know there's a lot of work to do. The Mental Health America research that was done ranking all states in regards to the prevalence of mental health and also the amount of services each state offers. Washington State, with all its wealth and beauty, ranked number 35 for being able to provide adequate care to our youth. We ranked 37 for being able to provide mental health care for our adults. We can do a lot better. There's so much work to be done in regards to health equity. We're currently doing it, but there's room for growth. And I believe that every child has the right to thrive and laugh and run and be the best they can be.